Good morning, everybody. Okay, so we're taking a kind of a deep dive into the mouth and how that connects to the gut and all of our wellness in general. So a lot of this will, I'm sure, make great sense to our dental professionals in the room, and may seem basic to you, hopefully not all of it. And then to other professionals in the room, it might be a little bit more eye-opening. So I'll try to explain the terminology as I go through, and if anyone has questions, let me know. Okay, so we're gonna be talking about the oral microbiome, what it's composed of, and the link that it has to systemic illness and disease, and hence longevity. So what is the oral microbiome? So it's this complex community of microorganisms that are in our mouth. And it is actually the second largest microbiome in our body, the first being the gut, okay? And it all is so interconnected. So included in this microbiome is bacteria, viruses, fungi, and archaea, and it inhabits your teeth and your gums, the inside of the cheeks, palate, our saliva, and supragingival tissues and plaque. And it can really change quite rapidly by a number of different factors, from our pH in our mouth to genetic mutations, bacterial interactions, and then I'll also get into oral hygiene and nutrition and how that relates to it. So this just gives a bit of an overall pictorial view of the key microbiomes within our body. So you can see we've got the oral one, which the major bacteria that are presented in the mouth are the Firmicutes, the Proteobacteria, the Bacteroidetes, Actinobacteria, and Fusobacteria. I hope I said those all right. It's a mouthful, but literally a mouthful. I didn't even intend that pun. But if you take note of the bacteria in the oral cavity and then you look at those other areas, you're going to notice a lot of overlap, right? So that suggests there's communication. The diversity of bacteria that we have really needs to be in balance, so that we don't have overgrowth of the harmful ones that can lead to, of course, dental disease, but also systemic disease. Okay, so just a little bit of background terminology here. So commensal bacteria, this is referring to the bacteria that is within us, the host, and it's not causing us harm. They're the good critters, the good bugs that we want. Pathogenic ones are going to be ones that can cause disease or infections if that oral environment microbiome is disrupted. And believe it or not, our oral microbiome and our gut microbiome, all of those things, have quite a relationship with systemic diseases like diabetes, cardiovascular disease, respiratory diseases, brain disorders, high blood pressure, and cancer. So it's very important. So some key factors that are affecting this microbiome include our nutrition, and I'll go into that more, but I can definitely put a big plus out there for vegetables. We'll get more into that. High sugar can have a very negative effect. Our hygiene and genetics, of course, play a role. Our hormone status throughout our life plays a role in how that oral microbiome is doing. And then lifestyle choices like smoking, chewing tobacco, alcohol, our stress levels, and even certain medications can influence it. So now we're gonna get into how this links to some diseases that affect our longevity, that affect the way we look, how we feel. So periodontal diseases are initiated and further propagated by what's happening with our oral microbiota. With regards to cardiovascular disease, studies have shown about a 25% increased risk when your oral microbiota is not healthy and balanced. That's pretty huge. And we know that, in the United States, cardiovascular disease is one of the biggest killers. That little diagram there shows kind of all the different systemic diseases that are influenced by this balance, and dysbiosis is referring to imbalance. So at the end of this lecture, there's a whole bunch of different references, so all of these studies you can check out if it interests you. But some of the proposed mechanisms as to how this happens is that when the microbiome is off, we're having inflammation that happens systemically in the body. So interleukin-6 goes up, CRP, which is an inflammatory marker, goes up, and then basically blood pressure can go up. Our lipid profiles can look really bad. So it's serious stuff, our mouth. Cancer, so this was really fascinating to me. So of course, when I thought about the oral microbiome and I was researching this, yeah, okay, oral cancers would make sense to be related to that. But there's actually strong links to pancreatic cancer, genitourinary cancers, gastrointestinal cancers, and what studies have shown is these big differences in the saliva profiles of people that, for instance, had the pancreatic cancer versus healthy subjects. So pretty crazy stuff. It's suggested that the oral microbiota can promote the development of cancer or carcinogenesis by inducing this chronic inflammation and producing oncometabolites. Diabetes. So about 11%, probably more than that, just 11% of our population is documented to have diabetes. And it's projected that about another 10% have it and just haven't been diagnosed yet. But our oral bacteria can actually move and translocate, not too surprisingly, to the gut. I don't know if you're aware, but in our gut microbiome, that's where about 70 to 80% of our immune system resides. Another really interesting thing about the gut microbiome is that we now know from newer research about 70% of our neurotransmitters are made there. But anyway, with regards to diabetes, this change that can happen in the oral microbiome appears to be affecting the gut microbiome, which affects the way that the pancreas is working, and insulin and glucagon and all these things. Respiratory disease, so again, more research here is showing that it looks like there's aspiration from the oral microbiome into the lungs. And so that can create dysbiosis in the microbiome of the lungs, and then of course lead to inflammation and disease. Brain health. So in analyzing saliva, it's been noted that there is a wide difference between patients who have spectrum diseases, so autism spectrum disease, versus healthy or delayed developing children. So oral microbiome, brain health, it's really fascinating. A meta-analysis also revealed that drinking alcohol, not too surprisingly, can be associated with the development of Alzheimer's disease, other dementias too. And it showed significantly decreased levels of this Firmicutes phyla and an increased level of Bacteroides in these patients. So again, more evidence of the importance of the balance of these different critters in our system. Depression is another one, so it really can affect the HPA axis, which is the hypothalamus pituitary adrenal axis. And it's been shown that when the microbiome is off, there's higher levels of depression and anxiety. So talking a bit about the healthy oral microbiome, and I'm sure our dental professionals here have a lot of insight into this. And I have to say that I found quite a bit of mixed data and opinions on this. So I think there's definitely cause for more research to be done. So I'm just gonna kind of present some of the stuff that I found. So hygiene, of course, can include things like flossing, brushing. Some people were proponents of oil pulling, specifically with coconut oil because of the lauric acid. Some studies showed that tongue scraping could be good, while others showed that it was really actually negatively affecting specifically bacteria towards the posterior part of the tongue. So, some differing opinions there. Eating vegetables. This was a big one that does seem to have some great evidence behind it in probiotic foods and also fiber, and it has to do with the nutrients in vegetables, specifically green ones and things like beets. So they're high in polyphenols, also fiber, it produces more saliva, but they create prebiotics. So prebiotics are basically what the body needs to make the probiotics, or rather the bacteria for the microbiome. So really you can think of the vegetables and some of these probiotic foods as starting materials to fuel making the healthy bacteria in your mouth, in your gut, all throughout your body, which affects clearly the way that we age both internally and externally. Regular dental checkups, of course, are gonna be important, and I had some interesting conversations over the weekend specifically about having periodontal checkups, so really assessing deeply the health of the bones and how that relates to overall wellness. And then mouthwash. How many people here use Listerine or some kind of mouthwash regularly? Okay. So I don't know if many of you have seen, there's all kinds of interesting stuff going around right now, from Instagram to journals to TikTok, but there is some very kind of compelling evidence that's coming out suggesting that overuse of antiseptic mouthwashes can actually be linked to hypertension. So commonly used mouthwashes, so that could be Listerine, it could be something that contains chlorhexidine, fluoride, is basically showing that with repeated daily use, it is eliminating too much of the nitrates in our saliva. And that nitrite balance is important because basically that has a massive effect on our systemic amount of nitric oxide, which has a big effect on blood pressure. So again, more research needs to be done here, but there are some very compelling studies that are showing links here. There was one done at the University of Texas, and I think it was about 37 people. So faculty and students, normotensive, meaning they didn't have any elevation in blood pressure. And they put them on twice daily use of a bactericidal chlorhexidine containing mouth rinse. And there was a significant amount of cases of hypertension after use. And then they took them off for 1 week and retested, and they went back to being normotensive. So, and there's quite a bit more research on there. And I actually spoke to Nathan Bryan. He is from Baylor College, and he's spearheading a lot of the research in this field, and I've got his information if anyone wants to kind of go down that road, but it's very interesting. So this is the proposed, kind of the hypothesis of how that mechanism could be working with regards to what's happening in our salivary glands, taking in, you see the veggies over there, plug for the veggies, the way that's changing our microbiome, and then just the influences of basically killing that, and how that could be leading to an increase in blood pressure because of that nitric oxide. All right, so getting into healthy microbiome, healthy gut, healthy body, healthy skin, aging well, all of those things. So again, vegetables, eat your vegetables. It really is true. There's so much great evidence scientifically and also just clinically speaking, what I've seen with my patients and myself over the years. Vegetables, I think sometimes might seem a little underwhelming, but we forget, a whole vegetable is full of live enzymes and vitamins and minerals, and there's fiber. And it's all starting here in our mouth with that. So it has so much to do with the way that our microbiomes in our mouth, our gut systemically are evolving, not to mention just the fuel that it's giving us. It's anti-inflammatory, it helps with all of these different stressors. Fermented foods, so things like, high quality yogurt that doesn't have a bunch of sugar in it, kimchi if you're into that. I'm a big fan of kombucha. I don't know who else likes that one. But that's, again, helping to kind of feed all of these systems. Definitely avoiding, copious amounts of sugar and really heavily processed foods. So in the United States, we do have very different food regulations, or in my opinion, lack thereof. Having studied in other countries like Australia and traveled a lot of the foods that we have here and are allowable here are not in other places because of the chemicals and weird things that are put into them. It's looking like regular daily use of strong antiseptic mouth rinse may not be so great for us. And then avoiding of, things that are harmful like alcohol, tobacco, those sorts of things are gonna support a healthy oral, gut, and systemic microbiome and just general wellness and longevity. So just to kind of sum it all up, there's a lot happening in the mouth. It's very much so impacted by everything from our genetics to our lifestyle, our nutrition, our stress levels, our hormones. Eating a diet rich in nutrients like vegetables and probiotics definitely seems to be contributing to overall health, not just with the oral microbiome, but otherwise. And keeping things like smoking, alcohol, and high sugary diets to a minimum are gonna serve you well. I'm gonna just put this over here. And then of course, dental health is crucial. So having a great dental professional in your life that can help maintain that part of your body is so important, more important than I initially thought prior to researching this. And then I did, again, list the references for the different studies of the data I presented, if anyone wants to look those up. All right. So go eat your vegetables at lunchtime. Thank you.